Okay, good morning. Welcome to the webinar, Dual Eligibles and the Medicare Savings Programs. I'm Dana Casserly with the Pennsylvania Health Law Project, and joining me on your screen are two of your presenters for today's session. We have Erin Gay and Katie McKee, both with the Pennsylvania Health Law Project as well. Today's session is the final session in a series of webinars that we've been hosting this spring, talking about the end of the COVID era continuous coverage protections in the Medicaid program. Throughout this series, we've been providing practical tips and information to help you or your clients or patients or family members maintain health insurance coverage through the Medicaid program now that those COVID era rules are no longer in place. So today, Erin and Katie will be discussing coverage issues for people who are eligible for both Medicaid and Medicare, and these folks are also known as dual eligibles. I'm just going to go through a little bit of housekeeping before we get started. If you have any questions for the presenters, go ahead and type them into the Q&A box in your Zoom control panel. Our presenters are going to stop twice during the presentation for questions, and we will try our best to get to as many questions as we can today while still being respectful of the 12:30 stop time. If you have any technical difficulties during the webinar, you can reach out to me via email. My email is event, that's event at phlp.org. So that's event at phlp.org. You can also try logging off and logging back in and see if that helps resolve the issue. The presentation today is being recorded, and a copy of the recording and the slide deck are going to be sent around to everybody after the webinar. I'm also going to put a link to the slide deck in the chat in a moment, so you can have that for reference during the presentation if you want to. And finally, closed captioning is available for today's session. To see the captions on your screen, you have to click the three dots in your webinar control panel and then click Show Subtitles. If you're seeing those subtitles and you want to disable them, click those three dots again and then click Hide Subtitles. So with that, I will turn things over to Katie, who is going to get us started today. Go ahead, Katie.
All right, thank you, Dana. And get the PowerPoint up. All right, so welcome everyone. And thank you for being here today. We're happy to be with you today to talk about dual eligibles, the Medicare Savings Programs, and we're going to be going through some tips for older adults and people with disabilities who may lose Medicaid coverage during the public health emergency unwinding, and hopefully some helpful resources. Okay. So just briefly about the Health Law Project, we are a statewide legal aid office. We provide free legal services to people regardless of income, and we are focused entirely on Medicaid access, access to Medicaid health insurance, and access to Medicaid covered services. So we run a helpline. People can call us or email us to reach our helpline. We provide community education and trainings like this training you're on today. We have a whole lot of really useful information on our website, including all of the recordings of the prior webinars in this series. We put out a monthly email newsletter with updates on Medicaid issues and issues related to other public health insurance programs like Medicare. And we do policy advocacy. And you can, if you go on our website, you can sign up for our newsletter and find those resources. All right, so just briefly, what we're going to be talking about today, we want to talk about dual eligibility and Medicaid options for people with Medicare. But we also recognize that many folks who have kept Medicaid during the public health emergency continuous coverage protections are going to lose it during the unwinding. So we want to go over options for people in these situations. Our focus today is on dual eligibles. This is largely people who are eligible for Medicare and who have Medicaid coverage also. So since we are talking about dual eligibility, we wanted to launch a quick poll here at the beginning, just to have a sense going in of what is folks who are on the webinar today, what is your knowledge of dual eligibility? All right. And as I'm seeing answers come in, it looks like we have a good mix. I'd say the majority feel like you have an intermediate understanding of dual eligibility, with about a third of folks saying you're about at a beginner level, and another 20% with an advanced knowledge. So hopefully everyone will be able to learn something today from the webinar. Okay. All right. So I'll close that out. Okay, so as I mentioned, dual eligibles are folks that have Medicare and some level of Medicaid. Folks with Medicare and full Medicaid coverage are referred to often as full dual eligibles. We're also going to talk about people with Medicare who just have help through the Medicare Savings Programs. We'll go through the Medicare Savings Programs, but primarily these are folks who just get help through the Medicaid program with their Medicare Part B premium. These folks are often referred to as partial duals. We know that this is a high need and high cost population. Medicare and Medicaid are both really wonderful health insurance programs, but they're also big bureaucratic programs, and it can be challenging to access care. So folks who are dual eligible for both Medicare and Medicaid have kind of unique challenges accessing care. They often need help coordinating benefits, understanding their coverage, and transitions can be especially challenging. A lot of people contact the Health Law Project when they're new to Medicare, or they've just become eligible for Medicaid. They already have Medicare and they're trying to understand, how do I use my insurance? So just to make sure we're all on the same page to start with, we wanted to briefly talk about Medicare and Medicaid. Medicare is a federal health insurance program. It's a huge program. It covers more than 65 million people in the United States, over 2.8 million people here in Pennsylvania. It's run by the Social Security Administration and the Center for Medicare and Medicaid Services. People are eligible for Medicare when they turn 65, or if they've been receiving Social Security disability for 2 years. And then also people with end-stage renal disease who need a kidney transplant or dialysis are also eligible for Medicare. Medicare coverage comes in parts. So, people with the original Medicare with the red, white, and blue Medicare card have Medicare Parts A and B through that card. Part A is hospital coverage. Part B is outpatient coverage. Medicare Part C is just a different way to get your Medicare Part A and B coverage. That's through the Medicare Advantage program. Some people prefer to get their Medicare through a private insurance company. So you see advertisements all the time, especially in the fall. UPMC, Aetna, Geisinger, Keystone all have Medicare Advantage plans. And Medicare Part D is Medicare's prescription drug coverage. So folks can choose if they want to have just original Medicare with a separate Medicare Part D plan for their prescription drug coverage, or they can enroll in a Medicare Advantage plan with or without Part D coverage. Most Medicare Advantage plans include that Part D prescription drug coverage. People on Medicare can have significant out-of-pocket costs. There are premiums, deductibles, coinsurance, and copays. So Medicare, again, is good coverage, but it can be very expensive. Medicaid is a joint federal and state health insurance program that covers people who fall into certain categories. In Pennsylvania, we call Medicaid the Medical Assistance Program. It's a program that's run by the Department of Human Services. There are many ways that people can qualify. There are many different categories of Medicaid. For people on Medicare, they typically qualify through because they have very low income and receive SSI. There's a category called Healthy Horizons for people with low income and low resources. People on Medicare sometimes get Medicaid through the MOD program, Medical Assistance for Workers with Disabilities, through long-term services and supports if they're getting home and community-based services at home. And then also many people on Medicare get help through the Medicare Savings Programs, which helps with the Medicare Part B premium and sometimes other Medicare expenses. So Medicare can be someone's primary or can be someone's only insurance, or it can also be someone's secondary coverage. If someone has Medicare, Medicaid will be their secondary coverage. Or if someone has private coverage, Medicaid will always be the payer of last resort.
Katie, I'm just jumping in because the slides aren't advancing.
Oh, I'm sorry.
No problem.
Thank you for letting me know. All right, so just some basics about how folks who have full dual eligible coverage, how their coverage works. So Medicare is always going to be their primary coverage, as I mentioned. For services that are covered by Medicare Parts A and B, Medicare is always going to be billed first, and then Medicaid is billed second to cover Medicare deductibles, coinsurance, and copays. Medicaid is the only coverage for things that Medicare doesn't cover. So original Medicare doesn't cover things like dental, vision, incontinence supplies. So for folks who have original Medicare and Medicaid, if they're going to the dentist, it's going to be their Medicaid that's billed for that dental visit. Medicaid pays second to Medicare Part A and B covered services, but does not pay second to Medicare Part D. So people who have Medicare and Medicaid get their prescription drug coverage through their Medicare Part D plan, and then get help through Medicare's Extra Help program to control those prescription drug costs. So even just saying this out loud, just talking through this one slide, you can see how confusing this can be for folks. Sometimes Medicaid pays second to Medicare, sometimes it doesn't. People on Medicare and Medicaid have multiple cards. We have pictures of the cards. They have their original Medicare card. If they're enrolled in Medicare Advantage, they have a card for that. They'll have a, if they have Medicaid, they've got an access card. If they're in the Community Health Choices program, which most dual eligibles are, they're going to have a CHC card also. So people often don't know exactly what they have, but if you ask them what cards they show at the doctor's office, they can usually pull those out of their wallet and tell you, okay, I've got this red, white, and blue card. I've got a UPMC Community Health Choices card. I've got this access card. And generally, we encourage people, if you are going to the doctor, just show all of your cards, because they will know at the doctor's office which to bill and in which order to bill. So just some more dual eligible basics. People who are dual eligibles automatically qualify for extra help. So we're going to talk a little bit about the extra help program. It's a program through Medicare that helps people with their prescription drug costs. And people can qualify either automatically if they have Medicaid, or through applying for that program if they meet the income and resource limits. But folks who have any level of Medicaid automatically qualify for full extra help. And once that extra help is turned on, it's turned on for the entire year. So even if somebody loses Medicaid coverage at some point during the year, their extra help remains in place for the rest of the year. People who are dual eligible can choose any Medicare health or drug plan they want. So sometimes people are confused about this and think, oh, I'm a dual eligible. I'm limited to dual special needs plans, DSNPs, which are a particular kind of Medicare Advantage plans that are available to people who are dual eligible for Medicare and Medicaid. But people with Medicare and Medicaid can choose any combination of coverage that makes sense for them. They can stay in original Medicare, they can enroll in a Medicare Advantage plan. They can choose to enroll in a dual special needs plan, which is just another type of Medicare Advantage plan that's limited to dual eligibles. Whatever they choose, their Medicare and Medicaid coverage are separate. Their Medicare coverage is primary and their Medicaid coverage is still their secondary coverage. Most dual eligibles, as I mentioned earlier, are for their Medicaid are in a community health choices plan, and they have a choice. There are 3 community health choices plans that they have to choose from. Most duals, as I said, are in CHC. Some duals are in the Medicaid fee-for-service program where they just have their access card for their Medicaid. This is folks who are in intellectual disability or autism waivers, or who are getting ID or autism services through the county programs, people in HIP. These folks just have access for their Medicaid coverage. And then most people have, they have their CHC for their physical health coverage for Medicaid. And then they also have a behavioral health plan for their behavioral health coverage. That one you don't get a choice of. Each county has one behavioral health plan for Medicaid. So someone who's a dual eligible would have their original Medicare card. They may choose to enroll in, say, AmeriHealth Caritas, PA Community Health Choices for their physical Medicaid health coverage. And then they may be in Community Care Behavioral Health as their county's behavioral health plan. All right, so I know that was a lot, but we wanted to just go through that briefly as some background. We're going to talk now about the Medicare Savings Programs. And these are also called by the County Assistance Office, these are referred to as the Medicare buy-in programs. And there's a link in the materials to, we have a whole guide to the Medicare Savings Programs. So if you want more information after this presentation, I'd encourage you to go to our resource library and access that guide. So we wanted to go over the Medicare Savings Programs because we know there's going to be lots of folks who have been kept on full Medicaid during the public health emergency continuous coverage protections, who are going to lose full Medicaid, but may still be eligible for the Medicare Savings Program. The primary benefit of this program for most people in this program, the help that they get through this is the state pays their Medicare Part B premium. So Medicare Part B in 2023, well, what is the cost this year? Is it $170? I'm sorry, I've completely blanked on what the cost is this year for Medicare Part B.
Yeah, I think it's $164.90.
Okay, I'm thinking of last year. So $164.90. So that's a significant savings for folks. If you get help through the Medicare Savings Program, the state pays your Medicare Part B premium. It stops coming out of your Social Security check, and you get that money back to pay for, you know, whatever it is that folks need. You can, you know, pay for groceries. It can go toward your rent. It's just a major help for folks to not have to pay for that Medicare Part B premium. For people with the lowest incomes, folks below 100% of the federal poverty level, they can also get help with their Medicare Part A premium if they owe a Part A premium, and with their Part A and B deductibles and cost sharing. The other major benefit to the Medicare Savings Program is it can help people get enrolled in Medicare Part B. So sometimes people don't enroll in Medicare Part B when they're first eligible because they have to pay for the Medicare Part B premium and they feel like they can't afford it. And normally, if someone delays enrolling in Part B, when they do want to enroll, they are potentially limited in when they can enroll. So that's something maybe I should have talked about back on the Medicare and Medicaid slides. When people apply for Medicaid, they can apply at any time. I could apply today. If I'm turned down, I could apply 6 months from now. There's no limit to when someone can apply for Medicaid. Medicare works differently. When you first qualify for Medicare, you get an initial enrollment period when you can enroll. If you don't enroll during your initial enrollment period, you can only enroll if you have a special enrollment period or during the annual general enrollment period, which takes place from January to March of each year. So if somebody didn't enroll in Medicare when they were first eligible, and they're not eligible for the Medicare Savings Program, they would have to wait till they have one of those circumstances to enroll, which could lead to a gap in healthcare coverage, right? If someone is eligible for the Medicare Savings Program, it allows them to enroll in Part B at any time of the year. The other thing that happens with Medicare is if you don't enroll when you're first eligible, you can be hit with a late enrollment penalty, which can really add to that cost. You've already heard the cost of Medicare Part B. This can really add to that cost to have a monthly late enrollment penalty added on that lasts potentially for life. The Medicare Savings Program eliminates any late enrollment penalties. Even if later you don't qualify anymore for that program, it just eliminates those late enrollment penalties and they don't come back later. So if you're working with someone who doesn't have Medicare coverage and should, it always makes sense to check and see if they qualify for this program. So just briefly, I wanted to explain the Medicare Savings Program is actually broken down into 3 categories. With slightly different benefits. People, when they apply for the Medicare Savings Program, just apply for the programs. The county assistance office on the back end determines which one of these categories that they fit into. So as I mentioned, folks with the lowest income below 100% of the federal poverty level, which this year is $1,215 a month for a single person. Folks in this category get help with their Medicare Part B premium. If they owe a Part A premium, they get help with that, and then the help with the Medicare cost sharing. Folks below 120% of the federal poverty level just get help with their Medicare Part B premium. And then folks between 120 and 135% of federal poverty level, the state can pay the Part B premium. But for this QI1 category, folks are only eligible for this if they don't also qualify for full Medicaid. So that can get complicated, but just to give you a sense of how the Medicare savings programs work and what the benefits of these programs are. We also wanted to briefly highlight the Medicare Part A buy-in program. Just because we've seen a lot of problems with people not being enrolled in the Part A buy-in when they should be. So people on SSI in the Healthy Horizons category or in the QMB category, which was on the last slide, folks under 100% of the federal poverty level, Medicaid can pay their Medicare Part A premium for these folks. So most people get Part A for free based on their work history or the work history of their spouse or a parent in some circumstances. But for people who don't have that work history, they can be hit with a substantial Medicare Part A premium to get that coverage. So for folks below 100% of the federal poverty level, they are supposed to get help through the Medicare Part A buy-in program. Sometimes we see that people are enrolled in the Part B buy-in, but not the Part A buy-in. There's been lots of issues with this. We've seen issues with this. PAMedi program has seen issues with this, and we've done advocacy with the state about it. So we wanted to just highlight if somebody is in one of these categories, they're getting help with their Medicare Part B premium, but they don't have Medicare Part A because they haven't been enrolled in the buy-in, reach out to the county assistance office and ask to be evaluated for eligibility for the Part A buy-in. If somebody isn't getting Medicaid benefits at all, they're going to need to apply. If someone is getting Medicaid benefits, for example, through the Medicare Part B buy-in, you should be able to just reach out to the county assistance office and say, hey, can you take a look and see, this seems like this person should be eligible for the Part A buy-in as well. Once it goes through, you'll know because the person will get a new Medicare card that shows that they have both Part A and B coverage. Department of Human Services has indicated they're doing data sweeps to try to catch people who should be enrolled in this program and enrolling them. And someone who has Medicaid coverage is going to have complete coverage even without Part A, but Medicaid is supposed to be the payer of last resort. This person is eligible for Medicare Part A with the buy-in. And someone has to have both Medicare Part A and B to enroll in a Medicare Advantage plan. Often folks want to enroll in Medicare Advantage plans because of some of the extra benefits they get. You know, I've heard from someone recently who wanted to enroll because of the grocery benefit that they could get through a particular plan. So not having that option limits people's coverage choices. Okay. All right, so now I want to get into some unwinding reminders and background information. So I feel like we're going to go through a little bit of a history lesson here. So as we all know, in January of 2020, a federal public health emergency was declared. And then in March 2020, the Families First Coronavirus Response Act was passed. And with that, states could get an increased federal match for their Medicaid program if they kept people on Medicaid during the public health emergency. So during this period, which started in March 2020 and ended at the end of March 2023, the Pennsylvania Medicaid program was not allowed to cut off people's Medicaid benefits, except in some limited circumstances, if somebody chose to withdraw from the Medicaid program or they moved or passed away. There was a federal rule change in November of 2020 that allowed states to reduce people's Medicaid coverage for people on Medicare. So we saw lots of people who were on Medicare who had full Medicaid coverage. After this rule change happened, folks could have their Medicaid reduced to just help through the Medicare Savings Programs. So just help with the Medicare Part B premium only if they qualified for that program. So lots of people lost their full Medicaid coverage and were reduced to just help with their Medicare Part B premium after this rule passed in November 2020. Late last year, there was a federal lawsuit filed in Connecticut that challenged that rule. And I'm going to talk about that a little bit on the next couple of slides. But as of April 1st, the continuous coverage protections that were in place for the past 3 years have now ended. So normal Medicaid eligibility rules are now in effect, which means that now the state is free to end people's Medicaid coverage or reduce their coverage. So if people don't complete their Medicaid renewals, they can have their Medicaid coverage terminated during the public health emergency. That wasn't the case. Even if people didn't fill out their annual renewal, they would just keep their Medicaid. Now, you must complete your Medicaid renewal paperwork or you can be terminated. The county assistance office must complete a renewal before they can terminate anyone's coverage. So that means folks have to go through the whole renewal process. If someone's coverage is going to be terminated, they have to get a written termination notice with a right to appeal. And we're going to go through those rights also. So just a little bit more about this lawsuit. So as I mentioned, after that November 2020 federal rule change, many people with Medicare had their coverage, their Medicaid coverage reduced to just that help with the Medicare Part B premium. And as a result of this lawsuit, at the end of January, the federal court in Connecticut, where this case was filed, issued a preliminary injunction barring enforcement of this rule. So the court said this rule was not correct. You can no longer, states, you are not allowed to enforce this rule anymore. So this preliminary injunction that was issued applied to people who were terminated from Medicaid, had their Medicaid coverage reduced, and were instead put in the Medicare Part B, help with the Medicare Part B premium. But many states essentially ignored the injunction. They stopped cutting off people's Medicaid benefits, stopped reducing people's Medicaid coverage, but otherwise didn't do anything else with this order. So a clarifying order was issued by the court at the beginning of March, saying that, just clarifying that states needed to reinstate people whose Medicaid coverage had been terminated, and also reinstate that coverage retroactively back to the date of termination. So anyone whose Medicaid benefits were reduced after November 2020, this court said, states, you need to reinstate their Medicaid coverage going forward and also retroactively reinstate that coverage. So, you know, now the public health emergency is over. Why are we still talking about this? Well, because the Department of Human Services is still working on reinstating people, especially retroactively. So people whose Medicaid coverage was reduced should have already had their Medicaid coverage reinstated by now, reinstated going forward. If somebody had Medicaid before and their Medicaid is turned back on, they would be put back in the community health choices plan they were in before. So that if they still have that card should still work. We know, because a lot of folks that we worked with didn't have their Medicaid coverage turned back on, that a lot of folks were missed. So if you are someone, or if you're working with someone who would like to have that coverage back, at least temporarily until the next time they're renewed, you can contact the CAO, the County Assistance Office, and ask to have your Medicaid coverage reinstated based on this order. It should have happened automatically, but we know it didn't for a lot of people. Next week, anyone who lost coverage should also have it reinstated retroactively back to the date that it was terminated. That retroactive coverage is through the access card. So it's fee-for-service Medicaid. So we're just encouraging folks, if you feel like you could have used that coverage, you need that coverage because you had medical bills that you incurred after losing Medicaid coverage, reach out to the County Assistance Office and ask for this retroactive reinstatement. They're still working through this, and having that secondary coverage, we know, can make a big difference for people in terms of medical bills. All right, so as we've been talking about, we know that many people were kept on Medicaid over the last few years due to the continuous coverage protections, who either didn't complete their renewals during the public health emergency for various reasons, because they didn't have to, they still kept their Medicaid. So we don't know if they still qualify, or maybe they did complete their renewals, but they were over the income and resource limits to stay on Medicaid, but they were maintained on Medicaid because of the continuous coverage protections. So the Department of Human Services refers to these folks as COVID maintained, and there are particular rules that apply to this population. We reference this Medicaid ops memo that outlines the unwinding policy. On this slide, there's a link to that later in the materials. So there are a whole lot of people, as you can see from the slide, 1.3 million people who are in this COVID maintained population, who likely no longer qualify, or at least haven't been completing their renewals over the last couple of years. We do have a link on this slide to a data tracker by county where there's not a lot of information on there yet because the unwinding has just started. But if you're curious, you can go to this Department of Human Services unwinding tracker. It will have data posted as we go through the unwinding over the next 12 months. So we wanted to talk a little bit about when the Department of Human Services can act on changes in people's circumstances. So as a reminder, people always must report changes to the county assistance office. That was true during COVID. It's just that the county assistance office couldn't terminate people during that time if they reported changes. But all along the way, people were supposed to be reporting changes. The general rule is that if you have a change to your household income, resources, et cetera, you should report that by the 10th of the month following when the change occurs. So if I get a new job this month and I have Medicaid, I need to report that to the county assistance office by June 10th. And you want to always report in writing, have proof of how and when you reported. So during this unwinding period, when the county assistance office can act on these changes that are reported depends on if the person is considered COVID maintained. The tricky piece is, you don't always know if someone is designated by the Department of Human Services as COVID maintained. It's not like they have a name tag or, something on their forehead saying that. I mean, certainly we know someone was COVID maintained if they weren't completing renewals throughout the public health emergency, or if maybe somebody got $100,000 inheritance and is in a category with a resource limit. That's someone who is COVID maintained. But that said, if someone is COVID maintained, the county assistance office can't act on any changes until they're scheduled for their full renewal. So if I was renewed in February, my next renewal should be in February of 2024. If someone is not in this COVID maintained designation and they report a change in their circumstances, the county assistance office can complete a redetermination of their eligibility based on those changes that they've reported. And if the person is no longer eligible, they can send them a termination notice or reduce their benefits. So as a reminder, if the county assistance office is going to terminate or reduce someone's benefits, they have to send a 15-day advance written notice with full appeal rights. If someone appeals within 15 days, they can keep their coverage while that appeal is pending. So let's just walk through a couple examples since this is confusing. So first, Rita. Rita is on Medicare and has been on Medicaid since December of 2019. During the public health emergency, Rita remembers seeing some renewal forms from the Department of Human Services, but never returned any of them. In July of this year, Rita receives an $11,000 inheritance and reports it to the county assistance office. The county assistance office does not act on the change in circumstances because Rita is designated as COVID maintained. Rita's Medicaid eligibility is reviewed at her regularly scheduled renewal in December of 2023. And at that point, her Medicaid may end or be reduced depending on what her resources are at the time of her renewal. So now let's talk about Martha, who has a change in circumstances, but is not in this COVID maintained category or designation. So Martha has been a dual eligible since September of 2019. Every September, she faithfully fills out and returns her renewal paperwork. She last renewed in September of 2022 and continued to meet the eligibility criteria for Healthy Horizons. Martha gets a part-time job in July and reports her new income. The county assistance office reviews her income and determines she's above the Healthy Horizons income limit, but is eligible for a Medicare Savings Program. Martha can receive notice reducing her Medicaid in August of 2023 to the Medicare Savings Program only. So remember, the county assistance office is always required to review someone for all Medicaid categories they could potentially be eligible for before terminating. We listed several categories here, and there's a link here for more information to our monthly income and resource limits for Medicaid and other health programs. These programs that are on this slide, Healthy Horizons, the various categories of the Medicare Savings Program, MOD, Workers with Job Success, Waiver, these are all categories someone with Medicare could potentially qualify for, but there are others too. MAGI, the category created by the Affordable Care Act. People with Medicare aren't eligible for that, but that's another category of Medicaid. There's all kinds of ways that people can qualify for Medicaid. And the county assistance office should be reviewing before they terminate someone's coverage to make sure there's not a different way that this person could qualify for Medicaid. So just some quick takeaways, and then we will stop for questions. Normal Medicaid eligibility rules and renewal rules resumed April 1st. So everyone who receives a renewal packet needs to complete it if they want to keep their Medicaid coverage. People in the Medical Assistance for Workers with Disabilities program, which requires paying a monthly premium. During the public health emergency, if people weren't paying those premiums, they could not be terminated. But now that the normal rules have resumed, if you don't pay your MOD premium, you can have your coverage terminated. So over the next year, everyone on Medicaid is going to have their coverage reviewed. If someone doesn't complete their renewal paperwork, they will be terminated, but you can still complete that renewal paperwork and turn in the verification documents after the renewal date. So if somebody loses coverage because they didn't complete their renewal, they have up to 90 days to ask the county assistance office to reconsider that termination and submit that renewal paperwork to have their coverage reinstated. People are required to get written notice before their benefits end or change. They're supposed to get a 15-day advance notice, and folks have a right to appeal within 15 days to keep those benefits in place. They have 30 days to appeal, but if they want their coverage to stay on while their appeal is pending, they need to appeal within 15 days. So with those takeaways, I will stop here and see if folks have questions.
Thanks, Katie. Yeah, there were a bunch of questions that came in, so let's go through some of them. First, I just wanted to highlight, Linda shared on our slide 6, where we talked just about the Medicare basics. She just noted rightfully that the only people that there's the 2-year Medicare waiting period for people getting SSDI benefits, but the 2-year waiting period does not apply to people with ALS or Lou Gehrig's disease. So thank you for reminding everybody about that or pointing that out. So those are the only people that don't have to wait the 2 years, people with that diagnosis. And then we had some questions about whether we would cover eligibility criteria to becoming a dual eligible. And we're not getting into the specifics of Medicaid eligibility for duals because our focus is on unwinding and kind of what will happen for people that have both Medicare and Medicaid and lose that. We're going to talk about that during the next half of the training. But we do have some links to eligibility related materials. We have an eligibility 101 training that was done earlier in this series, and there's a link to that on our website. And certainly if people have eligibility specific questions, we can try to address them today, or people can contact our helpline or reach out to Katie or I. All right, Katie, so some of the questions that came in: if a person has Medicare Part A only, are their medications covered by the CHC plan?
No. So I guess I would start by saying that circumstance really shouldn't happen. If somebody has Medicaid and they become Medicare eligible, even if the only coverage they have is Medicare Part A, they're going to be auto enrolled into a Medicare Part D, as in prescription drug plan. So someone would get a notice that they are eligible for extra help, the Medicare Extra Help program that Erin's going to talk about. They're automatically eligible for extra help because they have Medicaid coverage, and it will tell them you need to choose a prescription drug plan. And if you don't choose a plan, we're going to auto enroll you in a zero premium plan. So you wouldn't have a monthly premium for that, but your prescription drug coverage, once you become Medicare eligible, switches over to through that Medicare prescription drug plan. The only Medicaid coverage you have for prescriptions is for over-the-counter prescriptions, things that Medicare doesn't cover.
Okay, great. And then Jody asked, I think, looking for resources for comparing those dual special needs plans, you know, in terms of those extra benefits that you talked about that some Medicare Advantage plans can offer. She asked if we had any comparisons, and we don't have a comparison of those extra benefits, but I guess PAMedi would be a resource to reach out to, who might be able to, I don't know if they have any resources created, but they can certainly help people compare the different options available.
Yeah, and unfortunately, you really have to just examine the individual plans and see what kind of extra benefits they offer. And I think on the Medicare Plan Finder, you can compare different plans and see what they offer. You can set up an account on Medicare.gov that'll allow you to put in your information, and then you can compare plans. But right, we don't have anything for those benefits.
Okay. And then I think there was a question about the Part B penalty elimination for people that qualify for the Medicare Savings Program. I think the questioner was asking about anything in writing to show the CAO to stop charging that late enrollment penalty. But I think really, if somebody is eligible for the Medicare Savings Program, Social Security should update the system to eliminate that penalty. I guess if somebody's approved for the Medicare Savings Program and doesn't see a late enrollment penalty go away, that would be a situation to follow up with us or PAMedi about, right, Katie, for help addressing that situation.
Yeah, and if somebody is approved for the Medicare Savings Program, you know it went through because you stopped getting that Part B premium. That Part B premium stops coming out of your check. So sometimes that's what happens. Like we'll hear from people who say, I was approved for the Medicare Savings Program, but it's been a couple of months and my Part B premium is still coming out of my check. That means there was likely some information that didn't take in the communication between the state Medicaid program and CMS and Social Security. There's probably some miscommunication, and someone needs to follow up on that.
Great. Okay, and I think someone was just, I think, emphasizing the lifelong penalty for people that delay enrollment into Part B or miss that initial enrollment opportunity. So I'm just mentioning that, and I guess we're going to talk a little bit more about some ways around a late enrollment penalty in this next part of the training.
Yeah, and with these questions, you know, this is tricky for us because there's so much more information we could talk about, but we wanted to mainly focus on the unwinding and how the unwinding period can affect dual eligibles and some resources for those. But like Erin said, there's a lot of materials on our website if you want to get into that.
Okay, great. I'm just going to go through with some more questions. Someone asked, I think if a dual eligible is just in a regular Medicare Advantage plan, not a D-SNP, is it possible that they would have to pay a premium for that regular Advantage plan?
Yes. Yeah, D-SNPs are typically zero premium, which is why often people like them. People who are in a Medicare Advantage plan with prescription drug coverage, if they're dual eligible, get extra help with the Part D, the prescription drug portion of that premium. But if they choose a Medicare Advantage plan that has a premium, they would have that on top of their Part B premium.
Okay, great. Rita asked, and I think we're going to address this in this next section, if a Medicare beneficiary is seeking additional support when they lose coverage, is PACE and PACENET considered the same thing as extra help, or is it a different program with different eligibility? So we're going to talk a little bit about that. Extra help is different than PACE, and we're going to talk about those two programs in the next section. Someone just mentioned that I think some people don't use the term Healthy Horizons when they're doing their work. So can you just maybe talk about some other terms used for that program, or kind of talk a little bit more about who the Healthy Horizons people are?
Yeah, Healthy Horizons is the Medicaid category for older adults or people with disabilities who have income below 100% of the federal poverty level and resources below $2,000 for a single person, $3,000 for a married couple. PAMedi folks and people who work with Medicare beneficiaries would call it QMB plus.
Okay, great. Someone's asking where people can find information on Medicare eligibility, especially for people that are non-citizens or people maybe that don't have the work history to pay in for, or didn't work in a job that paid into Social Security. I guess I would refer like the Medicare.gov website, and also for people that really want to dig into the details, probably the Social Security Administration's POMS, what is that, policy operation manual?
Program operating manual. Yeah, if you Google SSA POMS, you can find those rules. And like Justice and Aging, if you Google, has a really good resource on immigrant eligibility for Medicare. That's, I think, a good resource. And PAMedi can also be a helpful resource if you want to call with questions.
Okay, perfect. All right, I'm going to try to get a couple more questions, and then we'll come back to some of these questions that we're not getting to after we go through the rest of the training. I think there might be some confusion about the data sweep. So the data sweep is just to catch people that should be getting the Part A buy-in and aren't. And then there's going to be kind of just the reviews that Katie talked about, just the annual renewals that are due, where people's eligibility for ongoing Medicaid will be determined. So those are two kind of different things. So just to clarify that, and if you have additional questions, let us know. And then Katie, in terms of that CAR decision and having people who had their benefits reduced inappropriately now with this lawsuit decision, if they get the coverage reinstated, will they get the money back on medical bills that they might have paid for the time that they had their coverage reduced before it got reinstated?
Potentially. I think that's something that people are unfortunately going to have to take up with their individual providers. So if somebody had got medical treatment after they lost their Medicaid, they were billed and they paid for that, they should go, if their Medicaid is reinstated retroactively, they should go back to their provider and say, hey, my Medicaid coverage was turned back on. Can you bill Medicaid? But yeah, that's going to be a tricky, I think, case by case issue where you're dealing with the individual providers.
Right.
The Medicaid program is not going to be reimbursing people.
Right. Yep. Great. Thank you. Just another quick question. How does anyone figure out if somebody is COVID maintained?
Yeah, that's why I said that's tricky. We don't know. I guess the county assistance office should know. But folks who know they haven't been completing their renewals, those folks are COVID maintained. And if people, if you're talking to somebody, I guess, or if you are a person who knows you're over the income and resource limits, you're probably also COVID maintained if you were kept on Medicaid just because of that continuous coverage protection. So we can make it an educated guess, but we don't really know.
Right. And maybe, contacting the county assistance office like you suggested, or that customer service center, which we can put in the chat here.
Yeah, and it's on one of our last slides, the customer service center number.
Okay, great. Okay, and then just last question before we get back to the presentation, and we'll leave time at the end for more of these questions to be addressed. And we can also try to send out some answers if we can't get to all the questions. In that example with Martha, someone was asking why she couldn't be on the MAUD program as opposed to having her benefits reduced just to the Medicare Savings Program.
Yeah, that's a good catch. If Martha is under 65, and she might very well be eligible for the MAUD program.
Yep. Okay, great. Thank you all for being so engaged and for asking questions, and continue to do so. Again, we will leave time at the end of the training address some more questions. So for the next part of the training, we just wanted to review some information to help people who will lose Medicaid during the unwinding. So as Katie talked about, there's over 1 million people that have stayed on Medicaid, and it's either clear that they don't continue to qualify, or the county assistance office at the Department of Human Services don't know if they qualify because they haven't completed renewals. So, you know, a lot of people turned 65 over the last 3 years. They might have been on Medicaid under the category that didn't count resources, and when their eligibility is reviewed, resources will be factored in and they will lose coverage because they have resources, or their income is too high for them to stay on Medicaid. Rules change when people turn 65 and or when they get Medicare. Other people with disabilities might have had changes to their circumstances that affect eligibility and may no longer qualify. So we wanted to review some information to help people that will lose coverage and that aren't eligible anymore when their situation is reviewed by the county assistance office during this unwinding process.
And Erin, before we get into that, did you want to launch the second poll?
Yes, thank you, Katie. I failed to look at the note. So Dana, if you can launch the second poll, we just wanted to get a sense of where people live or work in the state of Pennsylvania real quick. So if you can answer that question. Thanks for the reminder, Katie. Okay, so it looks like we have people from across the state, which is great. And a lot of folks in central PA, southeastern PA, but there's people from across the state participating in this webinar. So that's really great to see. So thank you. Thanks for answering that question. Okay, so just some things to keep in mind, because we get calls from people and this reminds us that not everybody is aware of some of these things. So the first thing to just keep in mind is that if people are in Medicaid managed care and they lose Medicaid, they are determined no longer eligible for full benefits or for any Medicaid benefits, the managed care plan stays in place for the entire month. So the state pays the plans a capitation rate. They pay, you know, an amount each month to the managed care plans for the members in that plan as of the first of the month. So the coverage goes for the entire month. So if I'm somebody who's on Medicaid and my benefits are ending, let's say June 2nd, I'm going to get, let's say I get a notice dated June 2nd that tells me my benefits are going to end 15 days in the future, so June 17th. So while my Medicaid coverage typically ends on the 17th, I will be in my Community Health Choices plan until June 30th. I will be in my behavioral health plan until June 30th. So the managed care coverage does not always end on the same exact date that the notice says your coverage is going to end, because of the way that managed care works. So just wanted to kind of highlight that. We've talked to people who had benefits reduced at, or they lost benefits at the beginning of May. They thought that their coverage immediately ended. They canceled appointments and treatments without realizing that they would stay in their Community Health Choices plan for the entire month of May. So just wanted to kind of highlight that nuance. The other thing, a lot of people that have Medicare and Medicaid are enrolled in those dual special needs plans that Katie talked about, those Medicare Advantage plans that are only available to people with Medicare and Medicaid. And these plans have a 6-month, typically a 6-month grace period, where somebody can stay enrolled in that dual special needs plan for up to 6 months after they lose their Medicaid coverage. And the reason why this grace period exists is because dual eligibles have historically had issues with churning on and off Medicaid. And so sometimes it's because of problems with renewals and they get it in late. So there might be periods where people lose coverage, but they get it back, you know, quickly. So there's this grace period built in. So people's Medicare dual special needs plan doesn't get taken away immediately and gives people a chance to reestablish eligibility if they are still, if they do still qualify based on the eligibility criteria for Medicaid. And a lot of times, people get a notice from the assistance office telling them that they're losing Medicaid, and they don't really kind of that doesn't, they don't really understand that, or that it doesn't, they don't realize they lost Medicaid based on that notice. But then 6 months later, they get a notice from their dual special needs plan, from their Highmark Whole Care, their UPMC for Life, their Keystone VIP, telling them that their benefits are ending. And that's what catches their attention. And that's when they realize that they lost Medicaid, and often they lost it several months ago. So if people are in a dual special needs plan and they lose Medicaid, we really encourage folks to connect with the PA Medi program. We're going to have a little bit more information about the PA Medi program, but this is the group in Pennsylvania that counsels Medicare beneficiaries about all various aspects of Medicare, including plan choices. And people should really connect with a counselor or volunteer with PA Medi for advice about whether it makes sense to stay in that dual special needs plan through the grace period, or whether it makes sense to pick a new plan for coverage going forward. So just wanted to kind of highlight those two things. The other thing we wanted to mention is that there is a new special enrollment period connected to Medicare Part A and B. So this is a big deal. This started January 1st of 2023, and it's one of several new special enrollment periods established to help people enroll if they delayed enrollment into Part B, or if they maybe were enrolled and dropped enrollment. This will help them get back into Part B. So Katie talked a little bit about, some people not taking Part B when they're first eligible. So this new SEP is specifically connected to loss of Medicaid. Before January, there was no special enrollment period to enroll in Part B when you lose your Medicaid coverage. Now there is. It is time limited, so people have to enroll in Medicare within 6 months of losing their Medicaid coverage. And if they do that, if they enroll within 6 months after they lose Medicaid coverage, they will not have a late enrollment penalty. So that's one way, around someone having that lifelong late enrollment penalty for delaying Part B or for dropping Part B. There is a specific form that people will fill out, and they'll have to submit that to Social Security. The Social Security Administration is who handles eligibility and enrollment for Medicare. And people should include a copy of the Medicaid termination notice when they submit that form, so that it's clear to Social Security that people are enrolling under this new special enrollment period. When people enroll through this new special enrollment period, they're able to choose their Medicare start date. So people can choose to have the coverage go back to the date that their Medicaid terminated, if maybe they're doing this a couple months after their Medicaid ended. Or if somebody does it right away, they can choose to have the Medicare start the first of the next month. So if somebody chooses to go back retroactively, they will have to pay those Part B premiums for the back months of coverage. Again, this is new. This is really important. The Department of Human Services is going to be, if they haven't already started, sending notices about this opportunity, this special enrollment period, to people that are age 65 and older who don't have Medicare based on the Medicaid records. So this is going out at the time of renewal to let people know about this. Advocates have encouraged the state to also send this notice out when benefits are terminated, and send it out to a broader group of older adults, including those with Medicare. Because again, like a lot of the questions, like Katie had mentioned, people might only have Part A or Part B of Medicare and may need to use this SEP to enroll in the other part of Medicare they don't have. So again, this is really important, and this is something that's new as of this year. We're not going to go into this, but I just wanted to also highlight that one of the other new SEPs that was created in January, starting in January, is for people that have been incarcerated and leave incarceration. Oftentimes people, if they had Medicare when they became incarcerated, they lose that at some point during their incarceration because they don't have income to pay the premiums. So There is another SEP to help people enroll into Medicare Part A and B without late enrollment penalty when they leave incarceration. So just wanted to highlight that as well. Okay, next slide. And then we just wanted to review kind of some existing special enrollment periods that are connected to Medicare health and drug coverage. So these special enrollment periods relate to Medicare Parts C and D. These aren't new, but we just wanted to kind of highlight them. If somebody loses Medicaid, they have 3 months to change their Medicare health or drug coverage or enroll if they haven't, but most of the time they're at least enrolled in Part D. There is an ongoing special enrollment period for anybody getting any level of extra help. That allows people to change their health and drug coverage once per quarter between January 1st and September 30th of every year. And then if somebody is in a special needs plan, a dual special needs plan or other kind of special needs plan, and their eligibility changes to stay enrolled in that plan, that also gives them a special enrollment period to change to a different plan after they become involuntarily disenrolled from the special needs plan for no longer meeting the criteria. So again, there's a lot of opportunities on the Medicare side for people to change their health and drug coverage after they lose Medicaid. Okay, the next thing we wanted to kind of make sure that we highlighted, this is another really important new change that we just became aware of, last month. This was just announced last month. So Katie talked a little bit generally about Medigaps. Medigaps are an option for people who want to get their Medicare coverage through the original Medicare program. There are deductibles and co-insurances that apply. And so Medigaps are policies that fill in the gaps of original Medicare coverage. They're also referred to as supplemental policies. So people who have Medicaid cannot buy a Medigap while they have Medicaid coverage. It's considered illegal to sell somebody on Medicaid a Medigap policy because it's duplicative coverage. When somebody has full Medicaid that pays second to Medicare, that kind of acts like a Medigap. It fills in the gaps. But so someone doesn't need to buy a Medigap policy when they have full Medicaid. So what we saw during Unwinding, well, I guess there are also very strict rules about when people can enroll in a Medigap without having their health conditions factored in, without having to possibly wait to have a pre-existing condition covered. So there are lots of nuances to Medigap enrollment. And if people don't enroll in a Medigap plan when they first become eligible for Medicare, then they may not be able to enroll later, especially if they have serious health conditions or if they're older. Plans can at some point decide to not cover people based on their health coverage, based on their age, and they can charge people more based on these things if they do enroll them. So states outside of the kind of what they call open enrollment period for Medigaps, there are guaranteed issue rights. So certain situations that people might experience might allow them to enroll through a guaranteed issue right into a Medigap, even if they've kind of passed that initial period where they have to be enrolled into a Medigap policy. Some states have a guaranteed issue right connected to the loss of Medicaid. Pennsylvania does not have a right connected to loss of Medicaid. But Pennsylvania right now is allowing a time-limited opportunity to enroll in a Medigap plan for people that lose Medicaid over the next year during this unwinding of the COVID continuous eligibility protections that Katie talked about. So they published, the Insurance Department of Pennsylvania published a notice in a bulletin last month that instructs Medigap insurers to not deny coverage, not to charge higher premiums based on someone's health condition, and not impose pre-existing condition coverage exclusions to people who lost Medicaid between April 1st of this year and April 1st next year, as long as they kind of are enrolling relatively quickly after someone loses Medicaid. So again, we could probably do a longer training just on this change. We do encourage people to check out the newsletter article that has information about this opportunity. Again, the notice, there's a link to the notice in the handouts. Contact PA Medi if people have questions about this, if they need help enrolling in a Medigap under this opportunity. And people can also reach out to us at the Health Law Project. And we're happy to answer questions before the end of the training about this. Okay, and just to kind of hit a little bit more on extra help. So Katie talked about the extra help program being connected to Medicare Part D as in drug. This is a benefit that's been around for as long as Part D has. So back into, back when all this started in 2006. And Part D, the extra help lowers Part D premiums, it lowers or eliminates deductibles, and it lowers or eliminates copays for prescriptions. Anybody getting any level of Medicaid coverage, whether it's full coverage or just the help with the Part B premium through those Medicare Savings Programs, any level of Medicaid automatically gets somebody full extra help. When somebody is approved for full extra help, it is on for the entire calendar year. Medicare doesn't kind of go back and adjust things during the year. Once extra help is turned on for somebody, it's on for the rest of the calendar year. And then every July, Medicare will relook at people that have both Medicare and Medicaid. So anybody getting Medicare and Medicaid in July or at any point after July, the extra help gets turned on for the entire next calendar year. So that's really important to kind of remember, because we hear from people all the time who are dual eligibles. This was the case before these COVID protections. It's the case now as the protections are unwinding. But people that have dual eligibility who lose their Medicaid are always concerned about the extra help and how they're going to afford their medications when that extra help ends. And we always tell people, if I'm losing my Medicaid coverage in May of this year, my extra help will be in place for the entire rest of this year. So extra help does not end at the same time Medicaid ends. It always goes at least until the end of the current year. And then for people that lose Medicaid after July, the extra help has already been turned on for the next calendar year. And Medicare doesn't come back and turn that off. So we're going to go through some examples that will hopefully make that more clear than I might have made it just now. And then anybody who automatically qualified for extra help, who might be losing that automatic eligibility at the end of the year, every September, Medicare sends a notice to people losing their automatic eligibility. It comes on a gray piece of paper and tells them, that your automatic eligibility is ending. People may still be eligible for it based on their income and resources, but they're going to have to apply to Social Security for that. And an application's included in that gray notice. And people can check out our extra help guide for more details about eligibility for extra help. Okay, just wanted to provide some information about PACE and PACENET. Again, this is a different program. This is different from Part D. It's different from extra help. PACE and PACENET is a prescription program available to older adults in Pennsylvania who have limited incomes. So to qualify, somebody has to be age 65 and older. They have to be a Pennsylvania resident for at least 90 days. And then eligibility is based on income only. Resources are not factored in. And PACE looks at last year's income. So if I'm applying, for PACE now in 2023, My eligibility is going to be based on my 2022 income, and then the income limits that apply are on the slide. And at some point over the last couple years, the PACENET income limits had increased from what they had been. So you can see that people, may be able to get help through PACENET, even if their income is higher than other people who, qualify for some programs geared towards people with limited incomes. Pretty generous income limits. Next slide, please. This is just a little more information about PACE and PACENET. Again, they're funded by the Pennsylvania Lottery. When PACE and PACENET looks at income, again, they look at last year's income, but the amount of money that people pay for their Part B premium, if they are paying a premium, does not count. So essentially, Medicaid, PACE and PACENET will not count the roughly $1,200, $1,300, $1,400 that people are paying in Medicare Part B premiums toward the income limit if somebody is paying those premiums. People can have other drug coverage. PACE can be a supplement to Part D. And it's a good option for people, especially those that will lose Medicaid, lose extra help at the end of the year. This can help somebody age 65 and older be able to continue to afford their medications moving forward into next year. One thing that I should have noted and didn't, that people on full Medicaid cannot get PACE or PACENET. So again, this will really help people who lose full Medicaid. And you can get PACE and PACENET if you're on Medicaid that is just covering your Part B premium, or if you're in any of those Medicare Savings Programs. Full Medicaid, you can't get it. Limited Medicaid, you can get PACE and PACENET. And PACE and PACENET's really easy to apply for. Applications typically get processed within a week. People don't have to provide a ton of information to apply. You can apply a variety of ways. So it's a really great program, and we just wanted to make sure people were aware of it moving forward. Okay, I'm just going to kind of run through these last slides pretty quickly so we have time for questions. Again, anybody who's an older adult or somebody who has a disability and is covered by Medicare, if they're losing Medicaid, they really should be directed to the PAMedi program. PAMedi used to be called a prize for folks that have been around for a while. It's Pennsylvania State Health Insurance Program. And their staff and volunteers are experts in Medicare. They provide free, unbiased Medicare counseling. You can contact them. Usually they're connected with the local area agency on aging in someone's county, but people can also call the statewide helpline and they can be directed to the local programs if needed. And again, PAMedi can counsel people on plan options, can help people enroll with this new special enrollment period, can talk to you more about the new Medigap guaranteed issue opportunity that's available to people during this unwinding. So they're a really great resource to people who need help on the Medicare side of things, getting things sorted out when they lose full Medicaid benefits. For some younger seniors that aren't on Medicare yet, those folks could go to Penny. This is Pennsylvania's marketplace connected to the Affordable Care Act coverage. So Penny is not a resource for people that are on Medicare already or those who are eligible for Medicare. So people on Medicare or eligible for Medicare should go to PAMedi. Other folks should go to Penny if they lose full Medicaid and aren't still eligible some way. Okay, and then we have some other resources: Medicare, the Customer Service Center, Contact the Health Law Project. The next slide, we have links to some information. I guess why don't we break for questions, and then if there's still some time after the questions, we can come back to some of these case examples. I guess I just don't want to miss the opportunity to answer questions before 12:30.
Sure. Absolutely. All right. Pamela wanted to just mention that extra help has not been showing up on consumers' Medicare.gov account until the month after they turn 65. Thank you for highlighting that. Joan mentioned that some DSNP plans in Philadelphia have dropped members shortly after they lost Medicaid. So we know dual special need plans, as Erin mentioned, can give up to a 6-month grace period, but they're not required to give a full 6 months. And you'll get if somebody is in a dual special needs plan, they'll get a letter about that. Let me see. And then I answered this in the Q&A, but Rita asked on slide 25, we talked about coverage through the CHC plan, even if you receive a Medicaid termination notice. For example, you get the 15-day advance notice on June 2nd, you're going to lose your Medicaid coverage June 17th. That even though you've received the notice saying your Medicaid is covered Medicaid coverage is ending June 17th, as Erin talked about, the state has already paid your managed care plan for the month. So effectively your coverage lasts through the end of the month. And that's true for anyone in a managed care plan. All right, so those were some questions. Let's see what else has come up in the chat.
Yeah, I think there's some in the chat that came in during your part. So after Susan's question about Martha being on mod, I think we didn't cover those questions before.
Okay.
Except for the one about COVID maintained.
All right. And I know somebody did ask, do you know, Erin, what is considered income for PACE? Well, I'm looking for other questions.
Yeah, I think it's kind of the standard Social Security benefits, pension benefits, probably Black Lung, VA benefits that somebody might be getting. I think it covers, interest income probably counts. So there aren't too many income exclusions that I can think of, except for the fact that, the amount of the Part B premium will be excluded from the income they count toward that income limit. And I think the PACE website has resources that will kind of go through more details about income that should be reported when people apply.
Okay. And Mason asked, if a dual eligible person no longer qualifies for Medicaid on redetermination, will they be able to receive Medicaid coverage until they have the chance to enroll in Medicare?
Yeah, so possibly, but not necessarily, right? So if somebody in that example that, Katie, using the June 2nd date with coverage ending June 17th, the managed care plan will go through the end of June. So if somebody, can use that SEP if they're needing to enroll in Part B, and if that gets processed quickly for coverage to be in place for July 1st, they shouldn't really have a gap in coverage. If somebody's already in Medicare and acts really quickly after they get the termination notice to, change their Medicare coverage to start July 1st, that would be no gap. But we know that sometimes it's going to take a while for that SEP request to be processed. It might take somebody a month or two to realize they have to follow up and do something. So there is a chance people could have a gap between when their Medicaid ends and when their Medicare coverage starts or changes. It just depends on kind of what the person's situation is and how quickly they act.
Okay. And then Kira asked, and I admit I can't remember the answer to this, but if someone is up for Medicaid renewal not till November, but their SNAP renewal happens in May, would they be COVID maintained if their income was above limits for Medicaid, or are they at risk for termination?
Yeah, so I think the COVID maintained gets determined by what happened over the last 3 years, right? If they completed renewals for Medicaid typically, but I think sometimes Medicaid uses the SNAP renewal information, right, to consider a change and may process it. But so this is one of those ones, I think there's so many nuances with these programs and with people's situation that it's hard to kind of say definitively what should happen. But if the person is COVID maintained on Medicaid based on what happened over the last 3 years, then even if they do the SNAP renewal and there's changes on that SNAP renewal, Medicaid can't act until the next Medicaid renewal, I guess. And if somebody, if people aren't sure if people should have been terminated or what might happen, please reach out so we can kind of dig into individual situations and try to give better, more targeted advice. I don't know, Katie, if you have anything else to add or if you disagree with,
No. Yeah, I think there's some, right. That's a tricky area and I can't quite remember because I think some people had their SNAP and Medicaid renewals, disconnected during the public health emergency, and they're trying to pull those back together.
Right.
Peter asked, if I'm on Medicaid currently and my renewal date is not till January 2024, I'm eligible for Medicare in November 2023. Should I sign up right away for Medicare or wait until the end of January? I know I will be losing Medicaid based on my income. I asked because of the premiums paid potentially for all of 2024 for dual eligibles. Yeah, and Peter, I think if this is your specific situation, I would suggest calling PA Medi to talk about that, or you can call us. But I think people are going to have to make different decisions about when it makes sense to enroll.
Right. Yeah. And sometimes, and again, we don't know, this is very new, so we have no idea how quickly Social Security is going to process these SEP enrollment requests.
Right.
So that's, I think, the thing that we're all curious about. And that will probably determine then what advice people are given about whether they should jump in when they're first eligible, or whether, just what the considerations are when making these decisions about timeframes for enrollment.
Yeah. And Susan mentioned that for that question earlier about if somebody is losing their Medicaid but hasn't signed up for Medicare yet, will they get to keep their Medicaid during that, until they can get Medicare? Susan just noted that if somebody appeals quickly, they would get to keep their Medicaid coverage while that appeal is pending, and that could potentially fill in that gap.
Yes, another great point, Susan.
Yeah. Angela said that you said that a dual could not be sold a Medigap plan, but what happens if someone previously had higher income and a Medigap plan, but now with less income can become a dual? That's a good question. What happens with their Medigap coverage?
Yeah, yep, that's a great question. So if somebody has a Medigap because they haven't been on Medicaid and then they go on Medicaid, they can keep that Medigap. There's no prohibition on keeping Medigaps when you have Medicaid. You just can't be sold a new one. The other thing to just keep in mind, there's a really old guidance memo that's still in effect, but if people go on Medicaid and if they act quickly after getting approved for Medicaid, they can request to suspend their Medigap. And they can suspend it for up to 2 years, which means then within 2 years, if they lose their Medicaid, they can get that Medigap, reinstated without having to go through the whole application medical underwriting process. So people new to Medicaid who have a Medigap could request to suspend that Medigap for up to 2 years, or they could keep it, or they could drop it. As soon as they drop it, they may not be able to get it back later.
All right. And that is all of the questions right now. Erin, I don't know if you want to go through a quick example or.
Yeah, sure. Yeah, Katie, do you think we want to go, which one do you think we should go through, Ted, Rebecca, or Sam?
Let's skip ahead to one of the, well, it doesn't want to skip ahead.
Sorry, I had it set up to kind of just do it bullet point by bullet point. You want to do Rebecca's?
Sure.
Okay. All right. Okay, so our case examples, we'll go through Rebecca and Sam, if people can stay on. I know we put a lot in these case examples, but hopefully they'll be helpful to refer back to, especially if you have a more challenging situation. So in this example, Rebecca's in the MAUD program. She had a renewal done in February of this year, and she still met the criteria for MAUD. But the next month in March, she turned 65. So at that time, she turned down Part B. She didn't think she needed it with the Medicaid coverage. She qualified for free Part A because she, had work history that qualified her for free Part A, and she got enrolled into a Part D plan with extra help. Because again, Part A or Part B, you get Part D if you're a dual. So Rebecca's over income and over resources for the Medicare Savings Program. So she's not going to get any help with the Part B premium to enroll her into Part B. And then she's up for renewal in February of next year, of 2024. So let's talk through what's going to happen during the unwinding for Rebecca. Okay, so Rebecca turned 65 in March when the continuous eligibility protections were still in place. She became a dual eligible in March, and therefore she is moving into CHC, or she already has changed the Medicaid coverage changed to a CHC plan. She should have been given the opportunity to pick one. And then because of some nuances with the unwinding policies, because she's 65, she can't be in mod. So she's COVID maintained, and she's moved to just a different category of Medicaid. So at her renewal, so she keeps Medicaid, now until the next renewal. So when she's renewed in February of 2024, she will be looked at as someone who is 65 and who likely has income and resources over the limit for other categories of eligibility. So she's going to lose her Medicaid coverage. She should get a written notice with the right to appeal, just in case there was any change in her situation, making her eligible for some other program. And she should contact the PA Medi program for help. She can use the Part B Special Enrollment Period to enroll in Medicare with no late enrollment penalty when she loses her Medicaid. And then PA Medi can also counsel her about her coverage options, original Medicare, Medicare Advantage, Medigap, all those different things. And because Rebecca would be losing her coverage in February of 2024, her extra help is already approved through the entire year of 2024. So she's going to lose Medicaid probably February or March of next year, but her extra help will continue until the end of 2024. All right, why don't we just cover Sam real quick? Thank you for staying on. So in this example, Sam's 80 years old. He gets Medicaid, Quimby benefits. So that's that Medicare Savings Program that pays the Part B premium, maybe even the Part A premium, and gives you some limited cost sharing help through an access card. And he's got Medicare. He is up for renewal in July. And Sam's having problems reading his mail because of macular degeneration. So he doesn't return his renewal paperwork. So what happens to Sam's Medicaid? So Sam's going to lose his Medicaid for failing to return that renewal, and he will get a notice about this. He's going to continue to get extra help until the end of 2024, because again, in July is when all this is playing out, July and August. In July, he's already on the list of people that have Medicare and Medicaid because he has it in July. Medicare has turned him on for extra help for the entire next year. So he doesn't have to worry about extra help. And then his daughter comes to visit him in the fall and sees all of the paperwork that Sam wasn't able to act on. So she calls, she gets help, and she ends up helping Sam complete the renewal paperwork, submits that, asks for reconsideration because she's still within the 90-day reconsideration period. The county assistance office reviews Sam and ends up turning him back onto the Quimby benefits back to when they ended. So he did, if Sam missed that reconsideration window, he would just reapply at some point, maybe if the daughter came in closer to the holidays toward the end of the year. So even if people lose Medicaid because they didn't do renewal, they can ask for reconsideration and people can always apply later. Like Katie said, there's no enrollment periods for applying for Medicaid and enrolling in Medicaid. So thanks for bearing with us and sticking on for a couple minutes. We have just information about our social media, ways you can connect with us. We have other trainings on our YouTube site that people can listen to if they are interested in. And then again, a plug for our newsletter where we'll keep people updated about any developments and changes that occur related to Medicaid and Medicare moving forward. And again, thanks for listening today. Thanks for joining us, I guess. And then Katie and my contact information is here. If people have any questions, reach out to our emails and contact our helpline. I think just since we're over, we'll end it here, I guess. Katie, you think? Okay, thanks again for all the good questions. We will try to follow up on questions we couldn't get to. And we really appreciate everybody staying on and being so attentive throughout. Thanks so much.